Hi there, my name's Nick Wiedenhoff, and for my online lecture here, I'm going to use my first aid and safety topic that I use in my class. I'm a 7th and 8th grade health teacher. I use this particular lesson with my 8th grade students, so I'm going to dive right into it. Here's my guided notes that I used. So first topic is responding to a medical emergency, whether that might be simply somebody falling off their bike or just coming to finding someone who's unconscious. There are 3 steps you should follow. The first step is check the scene and the victim. You want to make sure the scene is clear and safe for you to enter before approaching the victim. A car crash, for example, there's gasoline spilling everywhere and the car's on fire or something like that. The next step is call for help. Obviously, that would be calling 911 to get medical assistance for that. And the third step is care for the victim. They might be scared, they might be very nervous, so we're just going to be there to care for them. So those are the 3 steps. And then when we checking the victim, you should follow the ABC procedure. The acronym here, A stands for airway, so we're going to check if the person's airway is blocked, seeing if there's any object or something like that that is obstructing the airway. B will be checking if the person is breathing. You should be able to see if their chest is rising. Sometimes you can put your hand over just right above their mouth or nose and see if there's air that way. And then C, checking the person's circulation for signs of life. With this, we can check the neck or the left wrist. We want to focus on the left side. It's closer to the heart. It's going to have a stronger beat if there is a pulse there. It's important to use your index and middle finger for these. We don't want to use our thumb because our thumb actually has a pulse in it. So you might be feeling a pulse, but it might be your own pulse and actually not their pulse. As we move down here, we'll start talking about next topic is CPR. CPR and rescue breathing. Rescue breathing is an emergency technique here that you see here, where the rescuer gives air to someone who is not breathing, also known as mouth-to-mouth. We are physically breathing for the person. We're going to put their head back and tilt their chin, plug their nose, and put our mouth over their mouth and physically breathe air into the victim's lungs. Next, as we get into CPR, it combines rescue breathing and chest compressions. The rescuer performs the job of the heart artificially pumping blood to the body. For this, the rescue breaths and chest compressions, we are manually pumping the heart. Like I said before, we're going to put our hands right over someone's sternum, and we're going to push down almost a quarter of an inch or so, half an inch, and actually physically pump blood throughout the body. If you do it correctly, it will leave bruising on the victim. With this, there's a repetition of 30 chest compressions and then followed by 2 rescue breaths, and we will continue to use that until the person starts breathing on their own or until the medical help arrives. All right, next up is choking, and the Heimlich maneuver is a life-saving technique to help someone who is choking. A choking person usually grabs his or her throat, which is the universal sign of choking. So no matter where you're at, if someone is choking, it's important to know the universal sign of choking, which is just somebody putting 2 hands around their throat, not being able to talk. That's a giveaway that they are currently choking. And steps with the Heimlich maneuver to assist someone who is choking. First, we're going to lean the person forward. Then we're going to start with 5 back blows. Sometimes this will be able to dislodge the object that is currently stuck in the person's throat. And if those do not work, we will give 5 quick abdominal thrusts. We'll stand behind the person and just right above the belly button, we're going to make a fist, and then put our other hand around the person, and we are going to bring our arms and hands inward and upward, and that way we're getting air pushed up through the windpipe there and dislodging the object. Next, we're going to talk about bleeding here, controlling an open wound. For this one, we're just going to focus on a minor wound. something that doesn't require immediate medical attention. So the first step we need to do is wash our hands with soap and water here. You don't want to get any more bacteria that may already be in there that's on your hands, especially if we're outside on a hike and there's dirt, things like that. Second step will be to wash the wound with soap and water. Make sure the wound's clean. Make sure we get that bacteria out of there. We don't want any bacteria staying in there and making the wound infected and worse. The third step will be to place a sterile or clean cloth on the wound and apply pressure, just covering up the wound and applying pressure there, trying to get blood to clot so the bleeding will stop. Fourth step, once we stop the bleeding, we're going to remove the cloth and apply an antibiotic ointment if we have any. Once again, that way we're cleaning it, we're sterilizing the wound, lowering the risk of infection with that. And the last step will be to cover the wound with a sterile or clean dressing and secure it with a bandage. That way, it's secure. No more bacteria is coming into it, or it doesn't even have the chance to because the cut is no longer exposed. Next up, heat and cold emergency, cold weather emergency, specifically hypothermia here and hypothermia as well. Hypothermia is a condition in which the body's internal temperature is higher than normal. A lot of times we'll see this with cross-country runners or track runners or anybody doing things outside, particularly during the summer times when the temperature is very hot. It's important if someone is suffering from hypothermia that we get them indoors into a cool place. If there's no indoors air conditioning anywhere like that, simply putting them under a tree with shade or any sort of shady area will also work. We also want to give them cool water, not extremely cold water. The cool water, actually, the body will absorb that quicker than like ice cold water. And then for hypothermia, just the opposite of hyperthermia, it's a condition in which the body's internal temperature is dangerously low. See this in the winter times, anywhere out where it might be snowing or just cold in general. Somebody may, an extreme example is somebody walking on ice on a pond. They think it's frozen and they might break through and they get their legs in there. It's important, once again, just opposite of hypothermia, get them inside to a warm area. Remove any clothes that may be wet or cold on them. Wrap them up in a blanket and trying to keep them warm. Some warm water will work as well with this. And then our last topic we'll talk about in this lecture is our burns. So there are three types of burn degrees. There's first degree, which affects only the outer layer of the skin. This could simply be most commonly known as a sunburn. We will see. And treatment, we can use some cool water to help manage the symptoms, the pain, and then apply any sort of product that is created to treat superficial burns. Here, aloe, for example, to help with sunburn. Be an example of that. Next up is second degree here, and this extends into the inner skin layer, and the skin layer is going to be red, swollen. There may be blistering as well that can occur. Treatments for second degree, it's more serious than first degree. We're going to want to seek medical attention. Cool the burn with cool water. Apply a sterile dressing, and take steps to minimize shock. With the second degree burn, as we start to get into the inner layer, it's important, as you've noticed on here, and I've said, cool with cool water. We don't want to use ice. Some tissue might be exposed here. That's where they're not typically used to the extreme cold conditions that ice could bring with it, and there's actually a chance that skin the tissue that's exposed could actually get frostbite on it, just from the immediate coldness that the ice could bring. So we always want to use cool water. You know, people always think that ice, if it's cold, will be the best for it, but we actually want to stay away from that. And then the last one is a 3rd degree burn, and this penetrates all the skin layers as well as tissue beneath the skin. For treatment, we're going to want to call 911 immediately. 3rd degree is very serious. You're probably not going to be able to drive yourself or have somebody drive you to the hospital. You're going to want 911 to come right away. We're going to make sure the victim's no longer exposed to flames, heat, or smoke. With 3rd degree, typically we see this in some sort of fire accident. And then we'll, once again, take steps to minimize shock. Once again, cool water, 3rd degree. We're going to want to cover any sort of burns in general. We're going to want to cover up with some sort of dressing of some sort, so the skin is no longer exposed. There's always the chance of bacteria entering the burns, things like that. So that is my lecture on first aid and safety.